Hi, good evening. I'm Dr. Philip McMillan. Thank you for joining me as I ask this very simple but important question. The unvaccinated, can they still die of severe COVID? Okay, I'm not talking about COVID complications in terms of it, but severe COVID, like what happened early in the pandemic. What's the answer for that? Well, I'm going to share with you my answer to what it probably means, and therefore the science as to why I say what I say. If you haven't asked that question, you should have asked the question because it's an important question to be able to reflect on. And in order to do that, we'll get to the science. But before we do, I'm just going to quickly ask you to remember that coming up in a few days' time is the webinar. This is my first session, Health and Wellness. Lots of people are getting registered, and you can join. This is a question and answer session. I'll give some education about some specific things, but I want to know the questions that you have. Additionally, I want you to make sure that you go to Disease X, the landing page. You can get, and this is what we're preparing on Kickstarter. But in order to encourage you, we want you to get Capital COVID 19 Conversations. And this is just an excerpt of the conversations that were happening with Ron Johnson with experts from across the world. And it helps you to understand a bit more about the science that was occurring at the time. So if you're interested, look in the description below for information on that. But let's get back to this question here. What is it about the current time? We're now in 2024. There is a cohort of people who are unvaccinated. COVID is circulating avidly. Are they filling hospitals? Are the unvaccinated on the intensive care with severe COVID? Now, it's not that they can't be, but we're not seeing it. And so the question should be, well, why aren't we seeing it? What is it that is different now that wasn't in place early in the pandemic? Because we know that early on in the pandemic, certainly if you were unvaccinated, you had a higher risk of severe COVID 19 if you hadn't previously been infected. Now, vaccination certainly had an impact on that, but there's still a big number of people who hadn't had the vaccine. What happened? What's the science behind that? So that's essentially all I'm trying to see if I can answer. I'll give you a simple scientific explanation as to what I think is going on. So the first thing that you have to understand is about interferon. When you're talking about COVID, everything is about interferon. And what is interferon? So I've got here an image of a cell, and this is the cell. This is the virus. It's infecting the cell. And you have these, I've put them as little packets of interferon, but it doesn't quite work like that. But not to worry, this is just to get the concept. So this is the interferon. And so when the virus comes in and infects a cell, once the immune system within the cell recognizes that it's infected, it then releases interferon to go and warn other cells. So these cells know that they have had interferon coming to them. They know to switch off their protein making machinery so that even if a virus should infect them, it can't replicate. Some of the cells will just die if they are infected. And critically, it will pull in a lot of white blood cells that will come to defend the area. So, interferon is an absolutely critical response for almost all viral infections and some bacterial infections as well. And so, that was the critical reason why we ended up with severe disease. Now, again, you have to follow along to understand the sequence of events for what caused severe COVID 19. If you understand that, then you'll understand why I say generally now you're not seeing the unvaccinated filling the ICUs. It's just about understanding the science. So here is what you have is that I've got here, and I'm showing you again a number of slides that I'll take. This was from my advanced 360. So You should look out for that. It has all this information, like almost 60 modules of me collecting this research and information. But here we've got a healthy lung. It says the left and the right lung. This here is the trachea and down into the bronchi. And this is a cut section of one of the alveolar sacs right here. And this is where the exchange of oxygen happens. And there are about 480 million of these little sacs in the between the two lungs. So what happens is that, remember what I said about interferon. So when the virus infects the cell, what should happen is that it produces interferon early. And that cell then tries to switch off its protein making machinery. It warns other cells as well. It calls in the immune system. You have an early interferon response. And even if you continue to have viral replication, you don't have severe disease. Interestingly, I always mention, and this is from a paper from 2016 where they replicated SARS-CoV in mice. If you have no interferon response, remarkably, even though the titers of the virus go up and come down eventually, you don't have severe disease. What this is showing you is that the problem is not the virus per se, it's about the interaction with the virus and the immune system. And so when you have a delayed interferon response, and this is the delayed interferon response here, you can still have the viral titers rising, but then that cohort is at risk of severe disease. And that's the essence of what happens in severe COVID 19. So here is the reason why this is not as likely to occur, not as likely to occur in the unvaccinated. And the reason is in order for that delayed interferon, the virus has to be novel, meaning that the immune system had not come across it. Now, in truth, a lot of people had come across other coronaviruses, and if their mucosal immunity was adequate, those people wouldn't have a delayed interferon. And that's really the critical thing. It's all about the interferon response, the speed at which the interferon responds. I used the analogy previously where if you can imagine a burglar getting into, I use the White House as a typical example, and he got down into the bunker for however he did it, it would trigger the alarm across the whole of the United States, even though it's just one person. Now, what would happen is that if that happened, the security would know how to mitigate that from happening again. And so the only way for a typical unvaccinated person to have severe COVID 19 is if there was another virus like this one, which evaded interferon, got down to the lungs, caused quite severe inflammation in the lungs before the interferon response. It would have to be novel. But because the whole world has been exposed to this virus and variants of the virus, this pattern of severe COVID 19 that we saw early in the pandemic is unlikely to happen in the unvaccinated cohort. Now, I say unlikely because there's an important proviso in that. And the important proviso is to do with interferon autoantibodies. And this is what I'll show you this slide again so that you understand what that means. But if you can imagine, what they found is about 10% of severe COVID cases had interferon autoantibodies. So if you imagine when the cell is infected and starts to produce interferon, imagine that there are antibodies around that bind the interferon and prevent it from doing these responses. And that's technically what happens with interferon. So, what it does is that it augments the interferon evasiveness of the virus, which makes it more likely that it will get into the lungs without an interferon warning. That's like getting into the bunk of the White House. And it triggers a severe immune response, which, based on our research, we think then becomes an autoimmune response, triggering endothelial damage, microclots, and the whole works. And so That pattern is unlikely to happen in someone with normal mucosal immunity and who has been exposed to this virus. So it's no longer novel. And so, therefore, unless they have interferon autoantibodies, severe disease like what we saw early in the pandemic would be very unlikely to occur. What we haven't answered yet, though, is what is happening in the vaccinated cohorts. And that's a whole different discussion that hasn't really been properly analyzed. Is that once we started to see severe disease in the vaccinated cohorts, my question has always been, what is the pathology? Is it exactly the same as the unvaccinated? Is it different? Does it still come with all the microclots and all the other things associated with it? So that's the kind of research that needed to be done. So, in summary, again, just before as we finish, this is quick. Remember, the critical thing to remember in terms of severe COVID-19, it's everything is about interferon. If you have a normal interferon response, which triggers the immune system in the mucosal region, the chances of having severe COVID 19 with the immune pathology and microclots is very, very low. And again, you have to be careful because it's not impossible. And so this is part of the point that should help us to understand the science around what is going on. And I'm just trying to explain why some of the information that was given early on, sadly, it seemed as though it was more to frighten people rather than to understand the science as to why what happened in the first phase of the pandemic is not happening now across the world. Because remember, if you talk about first world countries, that's one thing, but a lot of the third world has only a small percentage of their population vaccinated. The question still remains, is COVID even circulating in those places? Because the immune system, the mucosal immune system, would have prevented that from occurring. So that's just a quick update to keep you on top of the science. Remember, coming up in just another few days is the health and wellness question and answer session. And we want you to get our disease, not the disease X, but the capital COVID conversations, which is part of the offering as we prepare for disease X and how to keep you safe and your family safe in the weeks and months to come. Have a great evening, and we look forward to sharing more science again soon.